So let's talk about all of this with Dr. Nihar Parekh. He's the Pediatrician and Director at Cheers Childcare. He joins in on the show. Dr. Parekh, hi, good morning. Good to have you on the show. And I must say that your video went viral and many people learned a lot from it.
Thank you so much. It's always a pleasure to contribute in whatever way we can. And our goal is always to reduce the panic and spread the right word. Hello?
Okay. And that really brings me, Dr. Parekh, to the other question, because what one is seeing is that with the Omicron wave, and I can call it a wave decisively now, given the spike in numbers that you're seeing, that even children are getting infected. Just wanted to understand what your take is on parents out there who are still a little nervous and hesitant about getting their kids aged 15 to 17 vaccinated.
So let me start by the Omicron, talking a little bit about the Omicron wave. Last 3 weeks in Mumbai, specifically the last 2, have seen an insane amount of cases in children, in adults. Now, it's the first time the virus is not differentiating between pediatric population and the adult population, which in a way is a good thing, because the way the virus is behaving in kids and in adults is pretty much the same. Initially, the adults in the second wave were suffering much more than the children, getting the second phase of the disease, which involved the lungs requiring ventilatory care and oxygen support. But this time, even that is not happening with them. The virus is behaving more like an upper respiratory tract virus with severe headache, body ache, throat ache. And the recovery phase is also drastically reduced from the 7, 10, 14-day period as compared to the Delta, now dropped down to the 3 and 5-day period, where within 5 to 7 days, you are through the disease without any short-term or long-term complications. Now, when it comes to the immunization between 15 and 17 years of age in our country, I think our government is doing a fantastic job. They are stimulating the population in the right way with the right age categories, pushing them step by step, not being overpowering as in the West, so as to get a rebellion back from the population. They're doing it the right way. And I think it's about time that we, as the population of India, support them in every which way. So we cannot play both sides of the fence. We cannot, kind of say that, okay, the vaccines are not coming, and when they roll out, we have 2 thoughts about it. These vaccinations have 0 contraindications. Whether your child has been through the disease in the last 15 days or 3 months, give the vaccine. No prior antibody tests are required or antigen tests are required before the vaccine. If you've given a regular immunization 10 days before, give the vaccine. If your child has just suffered from a cough and cold and recovered 10 days ago, give the vaccine. So there are hardly any contraindications. I would say absolutely nothing, unless until your child is in the midst of the disease itself, that you should not go for the vaccine. Otherwise, you should please encourage all your teenage children to go get the shot.
Dr. Parekh, further to what you just said, and this is great learning for all of our viewers who are tuning in and who are going to watch this interview on our social media platforms as well. Is the virus behaving any differently in adults to children right now? What we know and what is so far at least an established fact, I don't know whether this variant is going to mutate further or not. No one can really tell that. But the fact is that you're getting ill for 2 days and, very mild symptoms. You're getting a cough, you're getting body ache, not too much fever. It stops there. But in children, is it any different?
So, mild is a comparative term if we compare it to the second wave. But if you take it as a standalone disease, the Omicron does cause significant symptoms. There is significant headache, there is significant body ache, there is significant throat ache, there is loss of appetite. Your body does go through a little bit of a viremia, but it doesn't last for more than 3 to 5 days. So definitely, although the virus has become much more contagious, frankly, over the last 15 years of practice, I've never seen any virus which is spreading as quickly as this, is as contagious as this, not even the Delta variant. This is extremely, extremely contagious. But the good news also that it is absolutely not deadly so far. It is not sending kids to the hospital. As far as adults goes, also they are going to the hospital with, if they have comorbidities, just for monitoring as a precaution, as recommended by the family physician. But we are not seeing those ventilatory beds run out. We are not seeing those ICU beds overflow. Never in children, I mean, this wave, not the kids and not the adults. So I believe with its increase in contagiousness, the virus is losing its pathogenicity. That is, it's losing its potential to cause a deadlier disease.
That's actually great news. It sounds, I think, like what people had initially said, Dr. Nihar, about the influenza and how it progressed over the years, right? But having said that, we're talking about vaccinations for 15 to 18, and assuming that people follow the COVID protocol, there's still something that you can do nutritively to increase your resistances. Is there something that you can advise our viewers for themselves and for their children, those who have already gotten vaccinated? How do they protect themselves?
So I think, you know what, it's the wholesome life. I always tell all my patients, the teenage ones as well, that if you balance your day-to-day, sleep, good appetite, good diet, good exercise, stay clean, maintain hygiene, that's the biggest boost to immunity you can give. Supplements, as and when, please give only when your pediatrician recommends. But otherwise, there is not one such single supplement or 2 or 3 which I can tell you that if you take it, you won't get infected. Or if you take it, your recovery will be faster. Or if you take it, you won't get complications from the. No, it is the overall immunity of the child over years, which has been inculcated through healthy behavior, through eating right. Most important and the most under-noticed or missed out of all of this is sleep. Teenage children usually sleep much less because of the gadgets and the mental stimulation they go through. So I would encourage every child within 15 to 20 days and after that to get good amount of 8 to 10 hours of sleep so that the body gets enough rest to battle the virus which is going to get injected in your body.
Sure. Dr. Parekh, the other thing that I wanted to talk about, and specifically for children, when is it that parents need to sort of ring the alarm bell and consult their doctor? Because what one is also seeing in many cases now, because of all these, home tests available, that people are just testing at home, just, calling their doctor over the phone, upping their vitamin and, mineral intake and curing themselves at home. But when is the time that you need to panic and you need to say that, what, I need to get my child admitted to the hospital perhaps?
I think it's a very good question and people need to realize what are the red flags. So basically, when it comes to children, there is the mother's and the father's gut feel there's something wrong with my child. That gut feel should never be ignored. Number 2, from the day your child starts developing symptoms. Now today and over the last 1 month, if your child suffers from cough, cold, fever, I'm going to stretch out on a limb and say that 90% of the chance your child has the virus. Don't panic. Talk to your pediatrician, talk to your doctor, have good lines of communication. He or she is going to get you through this. But as a constitutional approach, if the fever lasts for more than 48 hours, you need to see your pediatrician. If the symptoms of headache, body ache, sore throat, change of voice is there, you can do a rapid antigen test at home. If the rapid antigen test is positive, it is 100% the COVID virus. If negative, there is a 30% chance that it can still be positive. Aware and be very open towards your child's general condition. If your child's general condition is stable, you're okay. If not, in the form of excessive drowsiness, excessive vomiting, loose motions, and lethargy, please don't sit at home even in the first 2 days. Talk to your doctor, go see them, and take the right advice in the right time. If you do that, I guarantee you, hospital admissions will be most definitely avoided.
Sure. Dr. Parekh, I know my co-anchor Alex asked you about what is it that one can do to build their immunity per se. But in smaller children, Dr. Parekh, I mean, what is the right way? Because it's already very difficult to keep them holed up in one's house, not allow them to play downstairs, etc., and keep them away from their play dates and friends. Would you say that isolation of some sort, because their parents are exposed in any which way, they've got maids, etc., and house staff coming in and out, isolation of some sort, is that going to be helpful at all? Because the way this virus is spreading, it seems only a matter of time that even small children are going to get it.
I think we're already there. I think plenty of small children. I think the youngest we saw was 2 days ago was a 2-month-old child which tested positive. Just to keep you guys updated, the child is doing great. So like I said, all the kids are recovering well. Now, whenever you have a child with symptoms or has tested positive, if the child is less than 2 years of age, you can't have that child wear a mask. So one of the parents has to step up with an N95 mask and keep the children or the child with them in one room. Now, let's take the bigger picture here. Our goal is to prevent and protect the elderly. So whatever it takes to keep these children or ourselves who are infected away from the elderly people, we should do. We should protect them because these are the ones with comorbidities who tend to suffer or chance to suffer the maximum. Number two, if your child is between 2 and 8 years of age, the child can wear an N95 mask and one of the parents can step up, the father as well, can step up and stay with the child. The latest recommendations are 7 days from the onset of the symptoms. If it's less than 2 years of age, nobody has the choice. A mother has to be with the child with an N95 mask at all times. If the child is above 8 years of age, 10 years of age, he's self-sustaining, she's self-sustaining, she can be trained to be in a room with the mask on for 7 to 8 days. But it is a difficult situation. So the dynamics of every house is very different. I think people are smart enough. It's been 24 months. We've been through the first, we've been through the worst. They're experts at isolation, they're experts at sanitation, they're experts at figuring out who stays whom and who to protect. So I think we need to trust the gut feeling of people by now. But most of the time, we still use N95 as our ace nuclear weapon against the virus till the vaccines reach all our children.
Having you today on the show and answering all our questions with such patience, but I think this was important for all the worried parents out there, and I think the message is clear. It's time to do away with surgical 3-ply masks or cloth masks. N95 mask is your only chance of survival. So yes, maintain social distance, get yourself vaccinated if you haven't. Booster shots are going to be available from the 10th of January for those above 60 years of age. And yes, for children aged 15 to 17, you can get vaccinated as well. So do that ASAP, and that is the only resolve. We're going to take a very quick break on that note. When we come back, we'll get you more news updates.